हाय गाइस। तो आज हम बढ़ने हैं वन ऑफ द इम्पोर्टेंट टॉपिक दैट इज कॉल्ड फिटल सर्कुलेशन। ओके, फिटल सर्कुलेशन। अभी जो फिटल सर्कुलेशन होता है ये आपको देखने मिलता है जब फिटस ऊंग में प्रेजेंट होता है। ओके, सीरीज व्हाट आर द फीचर्स। अब हम क्या क्या पढ़ने वाले हैं फिटल सर्कुलेशन में। इट इज नॉर्मल फिटल सर्कुलेशन, नॉर्मल फिटल सर्कुलेशन। नेक्स्ट हम पढ़ेंगे व्हाट आर द चेंजेस, व्हाट आर द चेंजेस आफ्टर दी बर्थ। बर्थ के बाद क्या क्या चेंजेस देखने को हमको मिलेंगे फिटल्स के अंदर ना। हाँ, तो अब हम फर्स्ट पढ़ते हैं नॉर्मल फिटल सर्कुलेशन एंड नेक्स्ट वी विल गो फॉर व्हाट आर द चेंजेस। ओके, चेंजेस जो है हम नेक्स्ट टॉपिक में देखेंगे। फर्स्ट क्या है नॉर्मल फिटल सर्कुलेशन। ओके, फर्स्ट लेट्स सपोज हियर इट इज योर placenta. Okay, let's suppose it is your placenta and this is umbilical cord. Okay, it is umbilical cord and here it is a fetus. Okay, these legs are there. Okay, these are the legs. Okay, these are the legs. Okay, next this is umbilical cord is attached to the umbilicus. Is attached to the umbilicus. Okay, here and we have here liver. Our liver is there. All these things are there. Next, first, okay, see this. First, umbilical arteries or umbilical cord contains two arteries, one vein. Two arteries, one vein. Just to remember this, umbilical cord contains two arteries, one vein. And here, the arteries is taking blood away from the fetus. Okay, away from the fetus. And the vein is taking blood towards the fetus. That's you remember. You have to remember. अभी first यहाँ पे एक vein है. This vein is made up of chorionic villi. Okay, chorionic villi. Chorionic villi from right chorionic villi and left chorionic villi makes vein. Initially, there are two veins are there, and afterward they will combine and form a umbilical vein. That is one vein, umbilical vein. Okay, this umbilical vein first come in the body and then they form a stunt. Okay, stunt, and small amount of blood is goes to the liver. Small amount of blood is goes to the liver, and most of the blood is goes to the what? Inferior vena cava. Inferior vena cava. This is our inferior vena cava. Okay, and again this liver, the blood again comes to the inferior vena cava. Okay, inferior vena cava. This is, and where the point that is attached connected this to the inferior vena cava, that is called ductus venosus. Ductus venosus, where the umbilical vein and inferior vena cava combines, that is called ductus venosus. Okay, now this inferior vena cava, the blood enters into the what? This is what? This is what? Right atrium, right ventricle. Okay, here right atrium, right ventricle, and pulmonary artery. Pulmonary artery. Okay, this is our pulmonary artery. This pulmonary artery is right, left pulmonary artery and right pulmonary artery. Okay, next, this is the blood come here, and here there is a it is these are the pulmonary veins. Okay, pulmonary veins are not mature, but how to see that this is pulmonary veins, and from this there is a origination of aorta. From this there is a origination of aorta. Okay, this is our aorta. Now you clear about this? Let's see a zoom video. Okay, see this here. In this right atrium and the right ventricle there is a special opening that is called what opening, that is called foramen of oval. Foramen of oval. Next, here in the right atrium and left atrium, sorry, right ventricle and left ventricle, there is an opening that is called VSD, ventricular septal defect. Okay. Next, here now you see that first blood come from these umbilical arteries. Okay, sorry, not umbilical artery, there is umbilical vein, and small amount of blood is goes to the liver, and most of the blood is coming into the inferior vena cava. From the inferior vena cava the blood goes and enters into the right atrium, and most of the blood is crosses this foramen of oval, directly enter in the left atrium, and small amount of blood which is come in the right ventricle, and again it is goes into the left ventricle by VSD. Small amount of blood that is taken up by these pulmonary arteries, taken up by these pulmonary arteries. Okay, the pulmonary artery, and here the blood which is present come under the right, sorry, left atrium. From left atrium the blood enter in the left ventricle, and from left ventricle the blood come in the where the blood come in the aorta. The blood come under the aorta, and here the aorta, here is a special connection that is called PDA or ductus arteriosus. Ductus arteriosus. Here is a ductus venosus. Here it is ductus arteriosus. Okay. Here ductus arteriosus is there, and whatever the blood which is come in the pulmonary artery, that is taken up by this PDA again to the what aorta. Okay. Again to the aorta. Next, the blood that is come to the aorta, that circulate to the body. Circulate to the body, and from this body there is a two iliac vein. Okay, two iliac artery, not vein, two iliac artery. From this two iliac artery there is a origination of two umbilical arteries. Two umbilical arteries comes to the umbilical cord. Two umbilical arteries comes to the umbilical cord. Okay, umbilical cord. This is our fetal circulation. Okay. Okay, see this. First, once again we will recap here. The blood which is come from this placenta through the vein, that is umbilical vein, that goes to the inferior vena cava. From inferior vena cava, right atrium, and most of the blood which crosses this ASD or ductus, sorry, foramen of oval, leading to the left atrium, and small amount of blood which come under the right ventricle, and from the right ventricle the most of the blood come under the left ventricle, and from the right ventricle the whichever the blood is present, that goes to the pulmonary artery, and from pulmonary artery, that is blood is taken up by this aorta through the ductus arteriosus, and in this left ventricle, the blood is taken up by the aorta to the body, that is to the body, and from the body there is a two iliac arteries. Two iliac arteries again joins to the umbilical arteries. Two umbilical arteries again go to the umbilical cord. From the umbilical cord, two arteries goes to the placenta. This is all about our fetal circulation. Is that clear?